A very good evening, a very good evening, and warm welcome to Epigenetic Epigenetic Medical Educational Care, brought to you, brought to you exclusively by Golden Hands Epigenetic Solution. First and foremost, for and on behalf of Golden Hands Epigenetic Solution, would like to thank each and every one of you for attending this webinar. Also, we would like to take this opportunity to wish all the fathers here and out there a very happy Father's Day. As for Ghes, Golden Hands Epigenetic Solution, our father and two pillars are Dr. PRABHU and Dr. Selva. So we would like to take this opportunity to wish our mentors a happy Father's Day. As you look at the image, every father likes to hold the hands of their kids. Similarly, our two Epigene consultants will hold the hands of each and everyone to guide you to have a healthy lifestyle. So we are in the episode 11 of free webinar. It's all about health, happiness, well-being for you, for me, and for everyone. As usual, please be reminded of the following house rules. This is basically to make our webinar more enjoyable and productive. So what you all need to do is only 3 things that you need to do. Firstly, you have to mute your device during the session. Secondly, switch off your video if you are not in proper attire. Lastly, unmute your device during Q&A session. You may ask questions to the concerned doctor. So we don't want any interruption or distraction during the session. Thank you very much for your cooperation. Today, there will be a very interesting topic that we would like to discuss today. It's about inflammation. As you all know, in order to summarize, to give you a brief explanation of inflammation. What is inflammation? Inflammation is the reaction of a part of the body to injury or infection, categorized by swelling, heat, redness, and pain. And if you look at the inflammation, is the root of most diseases. So please, viewers, don't take lightly on inflammation because it's associated with all the critical illness. If you were to look at the image, cardiovascular disease right up to diabetes, everything. So today, we will be talking more comprehensively on inflammation. What is inflammation, causes, symptoms, and mitigations? This is what our wonderful, experienced, and knowledgeable Epigene consultant will be talking about inflammation today. Before we go into it, let me explain about our company and about myself. Let me introduce myself. I'm Nesuraj from Golden Hands Epigenetic Solution for both Malaysia and India. Just passionate helping people to their health, fitness, well-being to next level using cellular health as a guide. So our mission, vision, and values, we cover only 3 areas, whereby looking beyond symptoms, we always look for root cause, a holistic way of life. We are not treat only body, but we assist with aligning you with your mind and soul. Last and not least is preventive healthcare. Preventing disease is what we believe in. So viewers, our epigenetic correction also comprises of 3 C's. As our vision and mission, which covers 3 areas, our epigenetic correction 2 covers 3 Cs. What are 3 Cs? It's basically a cellular correction, root cause correction, and metabolic correction, which associates with preventive healthcare. Why epigenetic correction, you may ask? Because epigenetic correction is a new frontier in medical science. So what you all need to do is just simple steps: BCG, visit, consult, and get corrected. All your issues concerning your health can be solved with this simple procedure. To talk about our company, we are 25 years in energy analysis and research, and we are reaching milestone of 25 years. And you can see this is how we grow year to year, day by day, and month by month. The hierarchy itself, it shows how we are growing in terms of in medical science, energy, and all concerning about health and well-being. For that, I should thank our mentor, so Dr. Prabhu, for having this wonderful epigenetic correction and our just all about. And this is what his biodata. He has vast experience in medical field, 36 years, 15 years as a ENT specialist, and all in energy fields. In terms of analysis research, he has done massively on human body, microvascular, heavy metal toxicity, quantum, and also not even that, he's been a motivator speaker, guest speaker, and hosting many medical seminars. Not even that, he has been an international advisor committee for European wellness. And these are some of his achievement, accreditation, and accomplishment throughout the years, and more to come. And this is our group of expertise for both just Malaysia and just India. And Dr. Selvam, he is based on India. He also has vast experience in medical field, 36 years as Dr. Prabhu. And he is a senior physician. He also does many wellness company and hosting medical seminars. So his accomplishment, accreditation, and achievement. As I used to tell in every webinar, this door is very, very important to all of us, including myself. Because why? The door of reversal, the door of recovery, and door of transformation is there for everyone, including you, me, and for everyone. This is the door of epigenetic correction. So in order to discuss on today's topic in detail, let me call upon Dr. Prabhu, Professor Dr. Prabhu. Let's hear it from him, and he will discuss more precisely on what is all about inflammation. Over to you, Doctor.
Very warm welcome and good evening to all of you. It's a great pleasure for me to join this beautiful session, even though a little bit, I would say, tight schedules down here in Bangalore, but still somehow I'm able to manage and then, come and give few information. And Nesaraj, I'm very proud of you. Thank you very much for the reason. It's more the way you introduce, the way you comprehend information and then putting across. I'm really proud of you with working with us in this epigenetic for almost 6 months. The way you are presenting, I'm very proud of you. Thank you very much. And I think our participants also will agree that the way you put across the information and every time something new comes in, that's where you induce the inflammation of inquisitiveness within us. So ultimately, with this beautiful journey, let's get into the inflammation. What exactly is that we are all talking about? Now, what is very simple definition of inflammation is it's defined as a local response, or sometimes it will be a general response for all the living mammalian. That means we all come under the mammalian group of living species. So whenever there is a tissue to injury due to any agent, and it is the body's defense mechanism or a reaction in order to either eliminate, that means throw the things out, or limit the spread of the injurious agent, as well as to remove the consequent necrosed cells and tissue. Now, if you see the creator or God or whoever created us and these kind of mechanism, this is something very, 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 very natural. Now, imagine if we all have to go on switching every reaction, and if there is a switch and we are supposed to go and switch on so that the necessary response take place, how many times in one day you all have to go inside and switch it on and off and switch it on and off? We in our home itself, switching on and off one television itself, we use a remote control. So easily sit down, switch it off and switch it on. And how many of us will get up and go and switch on, change the channel on the TV? We will not be able to. But there are millions of reactions happening in our body every day, in and out. In the millions of reactions, not one reaction you probably even realize. If you're in the healthy lifestyle, you hardly will you hardly will feel that there is something wrong in your body, and your body so silently will do all the job and keep quiet. Whereas you and me as a human being, just imagine you buy a brand new car. What do? We want to show it out to everybody. We will go on telling everybody. And today with the social media, we are so proud to post it in the social media. That's what we do. This is our human nature. But the same human beings who has all these beautiful cells inside our body, which not even one day will come out and say, hey, look, I have done all this for you. In fact, I have killed all the organisms. These organisms all were there since morning and I have cleared everything. And can I have something from that? A compensation. If your body starts asking for compensation for every reducing the inflammation, you imagine how many times you're supposed to compensate. And imagine the compensation, what the body will ask you is, take a proper diet, proper meal, and a proper thinking. Even your thought patterns also causes inflammation. Many a times we don't understand that, we don't realize that. But these are all very, very small things which happens. So what I'm trying to tell you is, just imagine yourself from outside and you're visualizing your body inside. And your body every second is fighting against something somewhere, and it is trying to either kill the bacteria, kill the virus or the fungus, and not only killing it, it will try to throw it out. Now, many times when it throws out, sometimes you may have a little pain. For example, you have a boil. Now, of course, the pustules is the pus which you see there is nothing but all the dead white cells. But once it becomes an inflammation, it's very painful. And then, of course, sometimes as doctors, we all have to open it up, remove the pus. And then from healing will start from inside out. Now, like this, the inflammation process is going on in our body day in and out, every second in and out, without our knowledge. So don't you think we all need to thank our body for this, thank our cells for this, thank our protectors which are there inside us? You should do all the thanking every moment of it. Now, the moment you start doing the thanking of every moment of your body cells, I think they will become so happy. The only response these guys, especially your cells, will do is they will just jump in joy. They will just release all the beautiful, good hormones, happy hormones, and then you'll feel very nice. Have you seen yourself many times, like when you're seeing a children or when you're around small babies or children, they'll be bubbling around. You will hardly see them angry, hardly see them crying for unnecessary things, hardly see the sadness in their face, especially babies are talking. Now, the moment we see the baby also, we also become happy. Automatically, we become happy. The same what we all need to understand, just because we have become adults, we need to tone down a bit and then start working on our calming effect. What is that? We should reduce the inflammation of whatever we do. So saying that, What exactly does it mean, inflammation? So I just split the words and then I am giving you the information. What is that? In is inside you, inside. Now, what is the flame? Is your fire. All right. So when there is a fire inside you, we can call it as an inflammation. Anything fire outside you, it's all external fire. But there are a lot of uh, causative agents in the outside world which causes the inflammation of the inside cell. So what is happening inside? There is a fire also going on. There is an extinguisher going on. The fire department working, putting off everything, on and off. And some cells get admitted in the hospital and then the cells get treated. These are all happening within your body. There are thousands of hospitals inside your body, all the specialists down there, and they do a fantastic job of putting the fire. Now, as long as the fire is put off or under control, you don't feel anything. Your life is beautiful. You'll be able to do your work regularly. You'll be sleeping. You'll be, doing your things as routine as possible, and journey will be beautiful. But the moment little fire goes up, what happens? It can be in the form of a pain. Suddenly you'll feel, hey, I'm having a little knee pain. Why is that? There is an inflammation there. You may have a little back pain. It can be a muscle ache. It can be a muscle pain. It can be a little sprain. Especially most of us would have seen and experienced when you get up in the morning, suddenly your neck, you cannot move. It is a stiff neck, like a robotic neck you will have. And you cannot move the neck. It's a stiff. There is a spasm there. So why it happened? For a long time, you exposed your muscle in a contracted state and probably didn't use a proper pillow. Automatically, it goes into a spasm and then it causes inflammation inside. That's when there is a pain. Now, this inside fire is what is inflammation all about. So as I told you, we have an inflammation happening inside. There is an inflammation happening outside. Outside, you and I cannot control, especially if you're living in cities like Malaysian cities like your Klang or your Kuala Lumpur, or like cities like Bangalore is the most polluted. It's very, very highly polluted. But what to do? If you see the kind, like the people down here, the population and the number of hospitals you see is very, very high. Every nook and corner you can see an hospital. So that means it is a business on one side for them, because when you are inflamed, they are happy. Of course, the inflammation causes diseases, and there are different departments for the diseases. Now, saying that, fire is inside. Now, this is something in general I want to give you an information. Now, fire inside or outside can cause what? Number one, it can destroy. That means destruction will happen. This is number one. But if there is something else which we can look at is, what we can look at is, number two is destroy the negative. Destroy the negative and renew. That is when something new can come, right? Like, for example, there is a tree, it caught fire and it's totally died. And then from the shoots, bottom below, if there are spared from the fire, they will once again regrow. So this is where, when you're looking from the spiritual point of view also, many times you need to burn your certain desires and thought patterns, which is causing an inflammation in your own cells through your thought patterns. So here what happens is you need to be positive, and the outlook has to be so positive that your inflammation is fully doused with water and then it cools down. It's like you get angry, and then when you say, I love myself, or when someone comes to you and talks to you, and you reduce your anger and then you calm down. So the calming effect, which is automatic actually, which is already an ingrained self-protective mechanism which God has already created with us. But if you see the general population, most of them, I would say around 80% of the population are always on the angry mood, always on the jittery mood, always on the very high desire mode, always on the go-getting mode, always on the achieving mode, which is probably 5 years, 10 years later, but they will be working towards it today. But when you look at, we should live for the day. That means you live for the day right from the time you wake up to the time you go to bed. What you need to do is you have to plan your day very beautifully. What kind of food are you going to eat? What are the exercises you're going to plan? How you're going to talk to the people? By your presence, how many people can be elevated up? How many people can feel happy by your presence? It can be your presence, it can be your moral support, it can be your financial support, it can be anything. But when you do that, if they are in fire and you be the water, or you be the douser of the coolness for those beautiful souls on earth, I think that is the most beautiful thing we can work on ourselves. And slowly what happens is, over a period of time, you become a very calm person, and then automatically your cells are calmed down and they don't need to work on high stress level for them to do certain things. So this is something very beautiful, and we all have to work on that particular level. Now, is it a protective mechanism? Of course, the inflammation is a very, very protective mechanism where it works on a response involving your immune system and immune cells, I mean. Now, for example, I'll just give you, the moment there is a foreign body entering into your nose, your own immune system will start triggering the respective cells to come down near the nose, and then it will say, stop, where are you going? You cannot enter inside because we are protecting this particular person and you better get out of here. But sometimes these guys will not listen, especially the foreign bodies which is coming inside your doors will not listen to it. What they will do, they will try to multiply inside. But immediately what happens is our immune system will immediately come inside. See, you can see the blood vessels will open up. The blood vessels will open up. Now, once the blood vessels opens up, what happens? A lot of blood gushing in. So more cells will come in, more oxygen coming in. So all are ready. So just visualize yourself how beautifully, just I'm talking in the nose, in the nasal mucosa, one foreign body guy comes in, a virus or a bacteria, someone comes in, your immediate guys comes inside and then say, hey, stop, cannot go in. So they fight against your. So that's where the immune system plays a very, very important role, and your blood circulation. Now you see, as you're growing older and older, what will happen? You will not have a proper blood circulation. And most of the times, we are not aware that we can actually enhance the blood circulation by, there are certain natural products available in the market where you can actually increase the blood circulation. And that too, I am very, very specifically sharing. In epigenetic, we do microcirculation analysis, and then we do enhance the microcirculation through certain medication, which is all natural nutraceuticals. Now, on the other side, the molecular mediators. What are these molecular mediators? These are the cells, your WBCs, your macrophages. These are the guys who are all damn powerful. It's like, a prime minister will have one set of close bodyguards, all the time they'll be, but there'll be other bodyguards, there are around minimum 6 to 7 layers of bodyguards for a prime minister or a president of a country. Now, how do we, but we won't recognize them. Most of the third and fourth ring and all, we won't even see because they're all in color dress. That means you won't even recognize. They'll be like a common man's moving around there, but they'll be very, very vigilant. If there is any situation of inflammation, there also I'm going to talk about inflammation. Immediately, these guys will come and then protect the prime minister. Now, in saying that, inflammation is a protective mechanism. So in that way, it is good. Definitely, it is good for all of us. So now, what is so good about it? Now, the same inflammation, when it good, what happens? It fights off the foreign invaders, heals the injuries, and mops the debris. That means it clears up all those guys and then throws them out in the form of a pus. But many times it's not the pus which comes out, but the moment they will absorb it and they will be thrown out in your system into the to be clear data. But what is the bad effect of this inflammation is? But when it is bad, as you see here, the inflammation ignites a long list of disorders. Now, why do say disorders is because when there is a chronic inflammation happening inside you, every disease starts coming in, but nobody will be able to tell you exactly, this is the disease you're going to get because of the inflammation. Nobody can tell you that. In that way, if you see asthma, arthritis, atherosclerosis, your blindness, your cancer, your diabetes, and sometimes, of course, they are looking at autism and mental illness. Now, in that way, I can give you a little more information on autism. Why? Because I have seen quite a good number of autistic children, and in our epigenetic practice, when we see their hair analysis, I found that most of them, 90 to 95% of the people will have mercury poisoning. Mercury, you just imagine they are 5 years old. But if you see, check their blood levels or through the hair analysis, we can see that they all have high levels of mercury. If high levels of mercury are there, what happens? Definitely inflammation will be there. Where is the inflammation? It will be in the brain because most of the mercury are in the brain. But On the other side, mercury definitely can be distributed all over the body, and it can be different areas where because of the mercury, it can be in your muscle tissue, it can be in your cellular tissue, it can be in the connective tissue, that means your ligaments, it can be anywhere. Now, all these definitely will cause a little bit of disorders in terms of the bad effects of the. Now, what is the ugly effect of the same? I think most of you would have seen the movie Good, Bad and Ugly, right? Here also, the ugly part of it. Now, sometimes, now ugly part of it, I wouldn't say ugly part of it because a person can die also after going through a lot, especially in the COVID time, we did see a lot of people dying. They couldn't breathe because the lungs were so severely involved, and the lung goes into a fibrosis. That means there's no tissue there. It's all like a fiber bands. It's called fibrosis, wherein how the blood also cannot exchange oxygen in those fibroses. And once the lung is converted into a fibrotic tissue, after that, there is nothing much there. And the person cannot breathe in at all. And there also, as doctors, what we do, we'll just push in oxygen through the nose or through the tubes inside. How much of oxygen you can be going on pushing in? Your body also will not be able to do anything naturally. So these are the cases you will see that the moment we stop the oxygen, the person will die. And these are all the ugly effects there. It can be stars after the chronic inflammation, especially if you see rheumatoid arthritis, you can see a lot of people having deformities in the hands. And it's all because of the changes which becomes ugly. That means it's a chronic. And especially people with psoriasis. I've seen a lot of people having the ugly effect of this is basically deformed joints and deformed in terms of joints only. Most of the time it will be joints which are deformed. So even the person may not be able to walk properly. So saying that there is always the good effect, there is always the bad effect, and there is always the ugly effect of an inflammation. Now, what are the signs of inflammation? There are 5 signs. Now, I still remember when I was studying MBBS, our surgical book had this particular photograph there for them to teach us that the 5 signs of inflammation. What are the 5 signs of inflammation? One is your heat. The second one is your redness. The third one is your swelling. The fourth one is your pain. And the fifth one is loss of function. Now, as you know, there are a lot of, like what you see on the right side is, have you seen that particular person is fractured his probably arm? Now, this is an example for you to understand that loss of function means you cannot use your hand on a regular basis. But after some time, you need to recoup back and then, restart everything. Now, as long as the initial stages of the heat, redness, mild swelling. Now, this part of it is still acceptable. Like what happens? Especially if you're having an allergy to a dust. What happens? The immediate is the allergens goes inside. You feel a little warm and heaty. That the redness you will not see outside, but inside there will be redness and there will be swelling of them. The moment the swelling happens, your body automatically tries to throw out the allergen. So what happens? What will you do? You will start running. You will have the running nose after an allergen going inside. And sometimes it will be continuous sneezing and sneezing and sneezing. Why? Because your body is trying to throw that particular allergen from your nose inside and then in the form of sneezing. That means it's blowing so fast that it's a high speed, it's like a high speed storm coming and then throwing everything out. It just whips out everything. It wipes out everything. So the same way our sneezing also is something like wiping out, especially the foreign bodies or the allergens. So when these 5 signs are there, if it is early, it's fine. But the moment it goes into a loss of function, that's something very, very sad, because even there also, if it is a fractured hand, of course, you can heal yourself after 6 weeks of the particular plaster of Paris. You still can heal yourself and get out of it. But what many of us don't understand is we all are having a chronic inflammation inside the body. Chronic is long term. Only thing is your body doesn't speak and tell you, hello, sir, I'm having this problem. Please try to cool it down or please do something for it. They don't tell you. Until a day comes, you have a disease, then only you get awakened. Not only you get awakened, the doctor who is treating you gets awakened and say, hey, you are right now having diabetes. Your blood pressure is high. Your vision is not good. Whatever the symptoms are, you see there are a lot of signs which the doctors are there to pick it up. Now, this is where MBBS is such a beautiful, I would say, the training program in our MBBS is so beautiful that we go very detailed and pick up all the information, pick the signals. But still, let me tell you, with my 36 years of my experience today, I still feel I don't know anything. I still feel I have to learn a lot. Just for today, let me be clear and frank with you all is, today was an inflammation topic, right? Can you believe until around 4:30, I didn't know what I'm going to present to you all. I didn't know what I'm going to present because my day was very busy. But at the end of the day, I picked up the slides and then I formulated it and I said to the universe, please guide me. You're going to show me. And I'm right now speaking to you all with the continuous information which flows in me and then I'm sharing with you. This is an amazing experience of me in this platform and sharing this information about inflammation to every one of you. So what is happening is inflammation, as I told, what you saw there, now you are seeing by a little bit of more explanatory method. This is where I'm going to show you on the top one. What is it? What you're seeing is the redness is caused by the dilatation of the arteriole. So there is an increased blood flow. Then there is some heat. So increased chemical activity and blood flow to the skin of the surface. So what happens? Automatically heat is developing. And what is the swelling caused by the accumulation of blood and damaged tissue cells? There is a oozing of the fluid outside. Okay, it will be a serous fluid which comes outside, and naturally it's a protective mechanism and a washing mechanism. Third is the pain, direct injury of the nerves, fibers, or the pressure of the hematoma, that is bleeding inside in the nerve endings, and the chemical irritants like bradykinin, your histamine, and the prostaglandin. These are all natural body protectors inside your body, which are slowly released and then it protects you. But for you, invariably, what happens is, if histamine is released, the moment histamine is released, you start sneezing. It's a natural body response to your allergen coming inside you. But what to do? It has no other job. It has to. That is the only way. But imagine it becomes a chronic, and every day you're sneezing and sneezing and sneezing for 6 months to 1 year. You will also get fed up. You go to a doctor or you get your ENT surgeon or to your respiratory specialist. What they will do, they will of course give you some kind of supportive preventive. You would have heard of people giving antihistamines. Anti means histamine is a protective mechanism where it releases it and cleans it up. Antihistamine is something to do opposite of what your histamine does. So your body is doing something naturally and you are taking a medication to do everything opposite. So what will happen? There is a clash of the titans. That means there is a clash of, I would say, the solutions. On one side, one person wants to give a solution, another person wants to give another solution. So this is where there is always a contradictory situation and a body gets confused. So once your body gets confused, they do not know what to do. So your disease gets persistently there inside you until you get fed up and then you leave all the treatment. You'll be walking along with a problem. You get used to the problem. Now, if it is just probably a sneezing other thing, maybe I think not many of us will have a problem because it's just sneezing, right? But if it is a chronic sneezing, definitely you will. And you need to carry a kerchief for every time you sneeze, water will flow down. You have to. But just imagine if this goes on to the deeper inside to your trachea or to your lungs, what happens? This can trigger your asthma. This is something very, very not convenient, not, I would say, comfortable for people. Why? Because just imagine a person who has lack of air, he wants more air by but his bronchi is going on smaller and smaller. And sometimes you can listen to someone like whistling, it's like whistling. That's the kind of breathing they will have. But those people you go and see when they come to the hospital, it's so pathetic for them. Now that's where we as doctors, we have fantastic injections. The moment we give one IV injection of a particular, the steroid normally, when we give that, you can see the changes in just next 30 seconds to 1 minute. The person really relaxes. How beautiful we have. So on one side, in medical fraternity, I'm proud to say that we have fantastic solutions for many, many acute problems. But when it comes up to a chronic problem, we cannot give you a total cure or a relief. That is when epigenetic comes in. That's when our cellular health comes in. That is where our molecular medicine comes in. So this is something very beautiful. Epigenetic is something which you all need to look into. If you don't understand, share it with your friends and come back to us. Especially if you don't understand, come back to us. We were there to assist you and get you more information on what you need to do. And once you know how to correct it, then move on in your life. Absolutely, you don't have to be a chronic patient. Change your lifestyle and move forward in your journey of life. So here, what are the types of inflammation? It's, as usual, very simple. I'm just going to show you that there is something called acute, means immediate. Now, what is in that acute? You can see inflammation is chemical irritants. For example, you inhale something like a bleaching lotion, which is their fumes, and then you inhale, you will feel irritated in your throat. Then if you have the frostbite is when there is a cold carpet, it's called frostbite. Then you have cuts, laceration, and stabbing wounds. There is an acute inflammation. Trauma like bruises, sprain, strain, broken bones, definitely there is an inflammation. Allergic reaction. Some bee sting, just bee sting, imagine, it immediately causes an inflammation and very, very painful. Burns, especially sunburn, the real fire burn, touching hot objects, all these also cause an inflammation. But on the other side, infection. Today, we all are exposed, bombarded with a lot of uh, bacteria, viruses. How? And that too, today's, it's all genetically modified guys are coming in, and then many times our antibiotics doesn't work, our treatment doesn't work. So what are we doing? We are doing nothing. We just don't know what to do. We just try our what do you say, whatever we know we have, and we give it to you. Even the latest antibiotic or latest this one, many times we are not able to help you. So in that way, I would say there are certain things you need to do is start taking care of yourself from all the exposures. I'm not telling you should not get injured. See, accidentally, if it happens, it's still okay. But there are a lot of things you all can prevent it. How? Keep your body fit. How do you keep your body fit? Very important, your food habits. Very important, your mindset. Very important, your regular exercise. And regularly, if you can check your cellular function through our epigenetic measures of picking up the information, definitely you can avoid a lot of problems which can come in the future, especially the chronic one. You see the chronic inflammation on the right side. What are you seeing there? Cardiovascular diseases. How many of you know that you get a heart attack? Definitely it is not a one-day process. It's not a one-day process. So what happens? You get a heart attack, you go down to the doctor will do an angiogram, then he will put a stent for you and then put you on a blood thinners, put you on some medication and send you back home. After that, what he will say, you have to be a little careful, don't eat fatty food, oily food, don't go for stressful thing. If you're under stress, bring it down. All these beautiful advices, then a nutritionist will come and tell you, you cannot eat this, you cannot eat that, you cannot do this, you cannot do that. All this they will tell you. Fine, right? Fine, right? But there is an inflammation going on in your body, isn't it? For your cardiovascular problem, whatever you face today. So how are you going to avoid it? Now, this is where you need to look at your own self. The inner fire, what is going on, nobody will come and tell you, this is the inner fire, this is the fire engine you should order, and this is what you need to. Nobody is going to teach you all that. It's through education. Now, this is where Golden Hands, we are very, very clear, very, very specific, and very, very concentrating on. In spite of, let me tell you, in spite of challenges we are facing, we still are, hosting this event. Why? Because even if it is 2 people, we are still hosting the event. If it's 3, we still host the event. Why? That's the commitment me and Dr. Selvam has taken. In fact, Dr. Selvam is not feeling good for whatever the reason is, but he couldn't join us today. But I also, from morning, I was so busy that I could have just said, cancel, Nesaraj, please cancel the program. I'm not able to. But I didn't do that. Even at the last moment of it, I spent 30 minutes, picked up the information. Because I feel that the more we go on sharing, I am also educating myself. So I'm very happy about it. This 1 hour in a week, I cannot give excuses, and it's just 1 hour in 1 week time. I need to spend my time. So in the same way, for you, it's the 1 hour time, 1 week once. Why not you come down? You bring down more people. You have to recommend more people. Come and listen. Come and listen. This is what you need to do. So coming back to the chronic, now you see autism. From where did autism come in a chronic one? It's chronic exposure to mercury. That's one of the reasons. But there are a lot of other reasons, environmental factors here in autistic children. It's not just mercury alone. So we need to work at there are few areas we need to work as a holistic approach. Rheumatoid arthritis, it's your joints. Then autoimmune diseases. How many of you know that autoimmune disease? Why is it called autoimmune diseases? Auto is something going on automatically, whether you like it or not, it's going on. And it is mentioned as immune disease. And many a times, nobody treats autoimmune diseases. Nobody treats autoimmune. Now, if nobody treats autoimmune diseases, what I mean to say is, just listen carefully. What I mean to say is, I'm not telling that doctor is not treating the auto. Yes, they're all treating. But what kind of treatment are they looking at? They are only treating your symptoms. They pick your autoimmune disease, they will name it as an autoimmune disease, and then finally treat you for that particular situation of symptoms what you have. For example, if you have a thyroid problem, the endocrinologist will put you on a specific treatment for thyroid. If it is your liver, or if it is your kidneys, if it is your diabetes, there are a lot of situations. It can be even your lung diseases. What happens? It's all autoimmune disease. Now, what we need to understand is in epigenetic correction, we can definitely bring down the autoimmune disease, which is running hayway. At least we can streamline them and then make them understand that, hey, don't fight your own self. Autoimmune is fighting your own self. Why are your cells fighting your own self? Why should it fight? We should go and find out the reason. So we have to go to the root cause of your autoimmune disease. Now, if I tell you the secret, don't be surprised. The root cause of all the autoimmune disease, other than your genetics, please be reminded, other than your genetics, it's in your gut. That means your intestines. If your gut is healthy, your autoimmune disease cannot be triggered. So there also, how many of you are thinking, see, most of the human beings, what mistake we all do is, or probably what wrong thought patterns we have is, we think that every day I'm going to toilet, I'm clearing my bowels, so I'm a healthy individual. No. Many a times you don't understand that there is a lot of toxins which are getting collected inside your body through the system, which we call it as leaky gut. That means your intestines is leaky gut, where all the poisons can go inside and then they get absorbed. Now that in turn can cause a lot of problem. Now this is where epigenetic comes in. This is where your cellular checking comes in. So what is your problem in coming and checking your cellular level and knowing if everything is fine, please go ahead and live your life. Nobody is going to come and put you on a medication when everything is okay there, right? Isn't it? But invariably, you will see that I can 200% let you know that 100% of the time, we are all not healthy at all. Like, for example, if I can say that I'm a healthy individual, I'll say, no, there is something going on. I don't know. But I'm trying to balance everything and then trying to, my body speaks and then I handle the speaking and then I listen to it and then I totally repair those significant issues which crops up and then I correct it. This is what I do. But you also can do that, provided you know what to do, when to do, where to do, and why should you do that? This is very, very important for you. So learning. Now, how do you learn? You can only learn either by your own methodology, which can be from the Google. Now, let me tell you, all the information shared in the Google is not correct. A lot of people are just uploading and uploading and uploading. Whatever they know, they will upload. I do say it's good for us. Information sharing is fantastic, but many a times it's all, I wouldn't know for what, why do they do that? They just get popularized by sharing a lot of information, and many times it's not right. So here you all need to get into a self-educative mode. Number one, read. But at the end of the day, do join us. See, like me, there are a lot of other doctors, a lot of other beautiful souls who may not be a doctor also. They can be just a nutritionist or they can be just naturopaths. They also probably will be hosting events like this. Please go and attend that. Please go listen to what they talk. Exchange information is very, very important, because I wouldn't say I'm the only best person as an allopathy doctor. I'm the only best person in the world to do treatment for diseases. No. Your Ayurvedic doctor can do a great job. Your homeopathy doctor can do. Your naturopathy can do. And there are a lot of self-healers like energy healers, Reiki masters, Manik healers, Tai Chi masters. There are a lot of ways people are getting healed. So here you need to understand that in this world, if God's grace, you're all sitting down here on this platform and then listening to Dr. Prabhu and then seeing what I'm talking, it's a blessing for me today. But at the same time, there will be other people, the same movement of it, they're also presenting and they are also giving information and they all also trying to do something for the society. So coming back to your chronic inflammation, as I spoke to you about the autoimmune diseases, then we are talking about depression, anxiety. How are you going to handle all this? Depression is what? You get depressed for what? Now, many a times I would say it's all a chronic inflammatory process which happens in your brain. Now, if your brain gets affected, you would have seen a little bit of schizophrenic people who are mentally imbalanced, you know. One time they'll be very good, the other time they'll be just the opposite of what the good they were showing you. You would have seen they're all called the bipolar people. A lot of people down there. Some people will be in totally depression. Why do they get into depression? If they lose someone in the family, very loved one or close one, they get into a depression. But there is an inflammation also happening in that depression also. It's a chronic inflammation. So you have to be very, very careful. And depression can be quite depressing, especially it affects women because the whole family gets affected and every system gets chaotic. Everything goes chaotic. And especially the children, if they are small children, definitely it affects their growth, their moral values, their morality, and a lot of other things that get affected if the mom is suffering. If the dad is suffering, there will be a lot of problem in terms of income generation. So it's a real challenge for all of us on this planet Earth with the kind of pollution we have, with the kind of polluted food we eat, adulterated food we eat. And many a times nobody is bothered, especially the people who are doing all the wrong things in the food industries, creating all the wrong preparations, using all the wrong additives. But nobody can, I wouldn't know how do you go on changing them. We don't need to go change anybody. You change yourself. Prevent that chronic inflammation happening inside your body. So you take care of yourself. See, why are you living on this planet Earth? If you're living on planet Earth, you should know what you need to do for your own self. That's where our self-care comes in. It's self-care. Self-care is sometimes seen as selfish. The world sees that as selfish. I say, no, you're not selfish at all. It's good to be selfish in the self-care way of life because that makes you more healthier. The more healthier you are, the more you can do for the people, the more you can do for your family, the more you can do for the society. So you need to be healthy, isn't it? To be healthy, of course, you need to take care of your inflammation consciously. Your body is doing a lot of job unconsciously, but you do your job a little bit of consciously. For example, if you're going on eating the same non-vegetarian food, which is an inflammatory, which is and causes an inflammation day in and out from morning until night, 3 times, 4 times you are, and all fried items, what happens? Your body goes through a lot of inflammatory situation. Initially, maybe first time, second time when you're a youngster, no issues. But in a long run, you start getting diseases. So what do you think? Getting a disease, you think you're so comfortable. Getting a disease, you think you're so proud of it. Getting a disease, you think it's a part and parcel of your life. No, getting a disease is not a part and parcel of your life. You should know how to protect yourself. You should know how to take care of yourself. God hasn't given you the wisdom. Yes, he has given you the wisdom. Don't do the wrong things. And don't do the wrong things at the wrong time at the wrong place and then expect the right result at the right time at the right place. Cannot. Wrong is wrong, right is right. This is what is this world is all about, is in a duality. Duality, always the right and wrong is there. But you cannot be doing the wrong always and thinking of it that there is something right in it. No, wrong is wrong, right is right. That means you have to balance yourself. You can't overdo also anything. You have to be in the balanced lifestyle. So there are a lot of neurological diseases, Alzheimer's, dementia, and Parkinson's, which is very, very common. There's a lot of inflammation happening inside. And then automatically there is actually they have put the word Alzheimer's, right? And the neurological diseases you can write. Cancer is another very, very commonly spoken language. In today's world, cancer hospitals are growing, people with cancer are growing, and people who are dying with cancer are growing, and people who are affected by cancer and then having the debilitated situation. The good, bad, the ugly of the inflammation. Yes, it all happens. So how are you going to prevent it? The only way for it to do not allow your chronic inflammation to spread out and then make a mess in your life. You have to be very, very careful. If it is an acute injury, you got a cut on your hand and then you get treated, it's all fine. But never allow that to happen in a chronic way. Now, as long as your body doesn't speak, don't think that it is all okay. You may do a blood test. You may get an X-ray scanning. You may get an X-ray or a CT scan or an MRI. Many times you may not find anything and then you think you're okay and then you're happy. But after 6 months, suddenly one heart attack will come and then you go to the hospital and doctor will put a stent and then you become a, wow, how come you became a patient overnight, is it? No, there has been an inflammation. There has been a fire in you. Only thing you didn't recognize it. Only thing your cells were trying to tell you that please put off the fire. Call the fire engine. But what is the fire engine? Your alkaline food is your fire engine. Fire engine. Your alkaline food is the one which can neutralize your acidic, whatever food you're eating. So every time you eat an acidic food, don't you think it's a duty to eat a little bit of alkaline food for the next few days? Because one day you eat a non-vegetarian fried item, maybe a stressful day, all okay, fine, right? It creates an inflammation. But at the end of the day, don't you think that it is your duty to take care of your little beautiful body by giving the benefit of alkaline food? Can you not take a little bit of yogurt? Can you not drink a little bit of alkaline water? Can you not eat a little bit of alkaline fruits? You can do it, isn't it? But most of us, what we do, it becomes an everyday routine that you just go on eating only the inflammatory food. But at the end of the day, where do you go? Inflammation will create another inflammation. And that inflammation will occur. Now, if all these bachelor guys, your cells and of the inflammation become one, what happens? They become very strong, you know. That is what is a chronic inflammation all about. It is all the chronic situation. It's been happening in your body for a very, very long time. So don't come and tell us that, doc, only yesterday I started having this problem. Only last 2 weeks only I'm having the problem. But you will be having a problem for inside for a very long time, which your body has been telling you and you don't listen to it. You have become deaf. Why? Your external happiness has become so important because you feel that going outside, you want to buy a car, you want to buy a house, you want to buy everything outside. And at the end of the day, get burnt in that particular process of investment. At the end of the day, when you die, the house doesn't come with you, the car doesn't come with you, the bank balance doesn't come with you. Then what the hell are you doing? We should become aware right from this moment of life. You should know what you're eating. You should know what you're thinking. The way you think all plays a very, very important role in causing an inflammation. And never have hatred towards anybody in your life. Never. Because hatred is another deadly poison. In Christianity, you can say forgive. Forgiveness is one of the it's not just Christianity all alone. Every human being on this earth has to learn how to forgive people, how to forgive and move forward, how to forget the past of whatever miseries or whatever difficult times we go through, whatever inflammatory. And in our journey of life, let me remind you, we are very, 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 I would say, what is that word? I'm not getting that. We are very specific in memorizing the inflammatory words, what people speak. And we go on repeatedly telling, you spoke like this and you did like this and it was you started with this. The verbal inflammation. So when you're talking about the inflammation, even the verbal inflammation is quite contagious and detrimental effects on your body. Why? Because every day you think that person is scolding me like this and I am like this. Because of that person, my life is like that. No, nobody can take your life. Nobody can cause an inflammation. It is you who are your thought patterns. And when you receive an inflammation, it is you who have to put out the inflammation. So here, life is such a beautiful journey. We all need to work towards putting off the inflammation, very calm. You would have seen like when you go to a forest or a greenery place, nature with a lot of trees and greeneries, butterflies flying there, birds chirping down there, squirrels running around there, then, a lot of nature. When you see that, don't you think you feel cool? That is alkaline. That is an alkaline effect of it. That is the like the fire engine putting off the fire. That is the effect of the alkalinity, that is a fair serenity, harmony. All this is beautiful. Is it? On the other side, you just see if there is a on fire. Like recently, I saw one Genting Highlands. There was a fire, external fire, especially when it's in a building or in a. There's a lot of damages happening. Are you happy about seeing it? No. You feel sad actually. So the same way, if you look at your cells inside you, the cells are not happy when there is inflammation coming inside you. Through food, you are consciously putting the food inside your mouth, and then what the cell has to do, the cell will think, what the stupid people don't even understand. Every day doing the same thing. Sugar is an inflammatory food, but if you see in the market, what is the price of the sugar? You see the white sugar, it's a bleached sugar, which is totally filled with sulfur and which is totally cheap. And then that's where people go and buy. 80% of the population goes and buys the white sugar. And the poison is already there inside it. And what happens? The more the poison, the more inflammation. And once you get a diabetes, no sugar. Totally, you think you're out of sugar means you people can. The inflammation, what you caused all the while. What did you do? So this is where you have to come back and then see, can I change the way inflammation is happening in terms of food? So start eating healthy food. Eat little food. You don't need a huge bunch of heap of food for your living on planet Earth. No, you just need little food. And you want to eat 3 times in a meal, no problem. Go for it. But you should know, be choosy. And many times people always this argument, I don't know, sometimes I get fed up of even telling people, doctor, if you're a vegetarian, how doctor, there is no protein at all. I say, on the other side, you go see the animals. Elephant eats, it's a vegetarian. Rhinoceros is a vegetarian. Hippopotamus is a vegetarian. How huge those animals are. Cow is a vegetarian. How beautiful they are. Why we cannot? Is it a mandatory that you have to kill something and eat? No, not a mandatory. It is not necessary. But if it doesn't cause inflammation, go ahead and eat. But can you prove to me that by eating non-vegetarian, your inflammation doesn't happen? Maybe 1 in 1,000 person who has been eating all the while non-vegetarian food, he will live until 100 years and he'll die. So you think you want to see him and then take a, what I would say, take his reference and then live your life that this fellow has eaten, so I also can eat. No, your genetic makeup is different. Your epigenetic markers are different. Your epigenetic correction is different. It's totally, so it's individualized. So please be careful when you're talking about acute inflammation and chronic inflammation. Next, what is it? So what happens? Any inflammatory from outside your environment, whatever said and done, what happens? You need to, there is some reaction happening. It can be acute or chronic, but in a chronic, can you see the conditions for cure? Tumor promotion, that means cancer. If your body cannot resolve back, if it resolves, there is a healing process happening, right? So here what happens is, don't not allow chronic inflammation. So in our journey of life also, I would repeat the same thing. We cannot be carrying on anger, carrying on hatredness, carrying on untoward vibration from against anybody under the sun. We can't. Time is little. It's a very, very short time. Let's live a beautiful life and start moving forward. And then let's live a very peaceful life. So I don't want to go into the detail. There is something called acute inflammation. There is something called chronic inflammation. And the longer the duration, the longer the problem, the more the complication. Now, at the end of the day, nobody can help you unless you help yourself. And especially when it comes up to chronic inflammation, the diseases, there are a lot of diseases it can be manifesting to you, and we do not know. And now recently, if you see, we all are bombarded with post-vaccination problems we are facing, autoimmune diseases, we are facing cardiac issues, and we are facing a lot of cardiac, autoimmune, and sudden deaths in terms of after effect of taking the vaccination. Your body doesn't know what to do. Your body wants to do something but doesn't know what to do. So there's a lot of infighting happening inside your body. That's where after the vaccination, you see a lot of people having autoimmune diseases. So here is where we come in and then we say, come, let's check yourself, and then we do the correction on it. This is where our Nesa, I'm telling Dr. Nesa, maybe I hope one day he can get a PhD and then get a doctorate. So Dr. Nesa's way of putting across thing is so fantastic that inflammation causes a lot of diseases. So saying that autoimmune disease such as rheumatoid arthritis or cardiovascular, your high blood pressure, your heart disease, gastrointestinal, inflammatory bowel disease, Crohn diseases, ulcerative lung diseases, COPDs, your chronic asthma, mental illness, depression, metabolic diseases like your type 2 diabetes, neurodegenerative diseases like Parkinson's, some cancers, tissue inflammation may result from exposure to certain factors like your environmental, chemical, pathogens, bacteria, viruses, and fungus and radiation. Now, radiation, if I have to tell you, most of us are being in Bangalore. I did a clinical study here by doing a hair analysis for most of the Bangaloreans. What I found was in the 100 people, 80 people all were exposed to radiation. None of them went for cancer treatment, but the radiation was very high. Through the hair analysis, we are able to pick the radiation. And that what does the radiation do? When you're exposed to the radiation from the sun, environmental pollution, what happens is it goes inside like a direct radiation into your skin, goes inside, converts it into lead. So lead poisoning is one of the very, very common problem in every society, every country. We all face this lead poisoning. So saying that inflammation causes a lot of diseases. So I would wish to continue this particular part of inflammatory webinar. Maybe I might probably prolong with another 2, 3, 4. I wouldn't know because there's a lot of information I need to share. And I think it's almost 40 to 45 minutes or 50 minutes of my presentation here. So with this, I think I would stop and give it over to Nesa, and then I will still continue the same topic next week. So until I see you back next week, have a fantastic anti-inflammatory lifestyle for the next 1 week. Enjoy the cool lifestyle, be calm, and enjoy your every moment of God's blessing that you are alive to stay on this planet Earth. And wishing you all good luck and fantastic journey ahead. Over to you, Nesa.
Thank you very much, Doctor. Thank you very much. Wow, wow, what a presentation today, Dr. Prabhu. Though he has a limited time, the way he put in, the way he has explained about the inflammation. So now know your fire engine now. Activate your fire engine, all of you. So this is the beauty about our Epigen consultant, because why? They will talk in 3 areas in terms of theory, practical, and also the real life experience. On top of medical, he too explained about verbal inflammation that we caused by words, and professional advice, what you need to do. And you look at the entire inflammation, I could say the impact is huge. So now we have to make the right decision. So now, dear viewers, please use this platform to share with your friends, because why, this is something very useful information that you all can able to educate yourself and to others as well, as what Professor Dr. Prabhu was mentioning about. Now, please unmute your devices. Now is the session for all of you now. So please ask question concerning about inflammation. If you're not clear, please to ask the question to Dr. Prabhu. Over to you now, dear participant. You all can unmute the device, then you all can raise the question now. Any question?
Good evening, Nisa. This is Malur here.
Yes, yes, Kamala.
Okay, my question is, I really thank Dr. Prabhu and yourself to create this webinar and give us all the relevant information. And my question here is, some of the disease that has been stated earlier, I realized that some of it can possibly be hereditary. So, knowing it by hereditary, can we prevent it from actually happening?
Okay, Mala, it's a very beautiful inquiry here. Okay, now when it is genetic or hereditary, as very simple to explain you, definitely there will be an inflammation because of that. Now, all the while we were in the understanding, like our medical fraternity, we were in the understanding that hereditary diseases, we cannot do anything. But today I can tell you very, very clearly and positively that the epigenetic factors which triggers the inflammation from outside, is much more than what your genetic or hereditary can cause. An inflammation and the process of it which causes the disease. But if you look at the general population, the hereditary inflammation and the disease process is just hardly around 5 to 10% of the worldly population. So if you look at the whole general population, it's only the 5 to 10% the hereditary part. Of course, we may not be able to handle the hereditary part of it or the genetic part of it. We cannot go and take out the gene and then put another gene there and then say stop. But what we all can do is we definitely can switch on and off the genes, especially in terms of the epigenetic factors, and slowly step by give a quality of life to these people who already are exposed to this DNA modification or the genetic hereditary diseases. We all can help them through epigenetic to correct it, to prevent it, and slowly give a quality of life. We have to give a quality of life. Now, this is where today I can definitely proudly say that my son, who has a congenital muscular dystrophy, he's 20 years old, very healthy, and he's happy, independent, and he's able to lead a very comfortable, decent life. All right. There are challenges we face because of his congenital situation. That's already came in his genetics. But my epigenetic correction, what I'm doing for him now and then, every time I do the epigenetic test, he will automatically get into that corrective mode and he will know what to eat, what not to eat. And then if you can come, I can show you next time when you come his bioquantum analysis or your hair analysis, everything clear. His toxin levels are very, very low, actually nil. Now, so beautiful, isn't it? So the moment you have a congenital problem, but epigenetically you correct it, I can definitely today guarantee you that we can avoid a lot of complications which are happening because of the epigenetic factors which causes inflammation. So are you clear, Mala?
I am, doctor. Thank you. But another one question. In that case, doctor, should we be treated much earlier or before that happens, since we already know that it's hereditary, come in for the treatment much earlier?
Absolutely. See, what I normally would recommend or request people down there is, if you see some hyperactivity in your child, the first thing you need to do is, if they are above 2 years and below 5 years, you can comfortably get a hair analysis done because it's a totally a non-painful situation. And at least from there, we know what's happening. Number one, maybe you can get it done yearly once or 2 years once, get a hair analysis because that's more specific. Now, for children above 5 years, we can go for a bioquantum or we can go with your, what I would say is, if you don't mind, I'll just answer this call because all are getting ready for the Father's Day celebration. Just let me answer this. Hello. So all in the josh of the happy, the Father's Day. So I'm taking my father who is around 90 years. Just we are all going out. So coming back to you, earlier the better. Okay, now when you say we are on one side, we are all healthy individuals, there also I will request at least yearly once or 2 years once, get yourself a bioquantum. That's a reasonable nominal one. Get it done and know where you stand. But if it is a serious hereditary disease, you already are predicting or you are knowing that it's going to happen, get a hair test done. Very, very important. Now, for people who want to get married, couples who want to get married, what I would request them is 6 months before you get married, please come and get your hair analysis. We will exactly tell you what are the problems you may face after after you become pregnant, or you want to conceive, you want to be healthy, isn't it? And can you believe when you see a lot of folic acid deficiency, let me tell you, it causes a lot of brain damage. Now, once you want to correct it when your child is having autistic child, or there are so many problems you can face because of those deficiencies. Now, do you think you're very happy you're correcting it later on? No, we all want to correct it before. So here, please, the moment you get to know, you on one side, there are two things you need to understand. Number one, For hereditary disease, you all won't come to me and say, doctor, please diagnose this hereditary disease. No, I am not here to find out, pick up a hereditary disease. You will probably go to a hospital. They will do the blood test. They will probably do a DNA test and do everything. And then they finally come out with a diagnosis. The moment you get the diagnosis, then come to us. Get treated with those beautiful souls who are all helping you to diagnose a congenital problem or a hereditary problem. But get back to us and then say, doc, we all want to know what is the epigenetic factors affecting our health. Can you check for it? We are there to assist you. So what happens? It is a beautiful balance between the regular allopathic doctor who are all into the field of diagnosing a major hereditary problem. On the other side, we are there to correct those epigenetic factors, balance the journey of life, and finally what? Give a quality of life. This is what we all want to do. Let's give a quality of life. Thank you, Mala.
Thank you, Doctor, and happy Father's Day to you.
Thank you so much. Thank you. Thank you.
Thank you very much, Mala. So, and to other participants, is there any other questions?
The participants, I think they're all calling the fire engine, trying to call and then come put the fire off.
All right. If there is no any other question, we shall move on to the final segment. All right. Okay, before I hand over this segment to Archita, so I'd like to share with you all something. All right. Okay, the moment if I were to say about AI, everyone is well versed what is AI all about. Yes, it is a artificial intelligence. Okay, now if you look at artificial intelligence, this is what the world are moving towards this, and most of the segments and economic sector has been taken over by AI now, and near future is going to dominate the entire world. And what is artificial intelligence all about? It's a stimulation of human intelligence in machines that are programmed to think and act like a human. But do you think there is one AI is been traveling with you ever since you born? You see, this AI, artificial intelligence, you need to acquire knowledge. But another AI, which I'm going to explain now, is there is no need to you to acquire knowledge, but only it needs to acknowledge your inner self and your cellular level. You see, our body consists of 50 trillion cells. Okay, each 50 trillion cell, each cell operates at 1.4 voltage. You know that how big you are, how strong you are. You see, as what Professor Dr. Prabhu Kumar was mentioning about, you see, all the hospitals, all the specialists, all are within us. But we fail to activate it because why? We are not aware of our AI. Because the cells only need our attention. Okay, it's only need our attention. Once you give attention to our own cellular level, what our cellular will do is it will, an entire cell will be happy. If your entire 50 trillion cell is happy, what about your body? Your body will be even happy. If your body is happy, what is going to do is, what is going to trigger is, it's going to trigger all your happy hormones. What is happy hormones? Dopamine, endorphin, serotonin. All these important happy hormones started to operate at the optimum level in your body. So it's a time for you all to do a full health assessment. As what Dr. Prabhu was mentioning, even your blood test, even your medical and medical test does not give a result of your cellular level. Only with epigenetic correction it does that. Only through epigenetic correction it goes to the cellular level and it can say what is the deficiency of your cells. So please viewers, it's never too late. Okay, it's never too late. Get your body assessment through epigenetic correction, how you can always connect us at our epigenetic, golden hands epigenetic solution at our number both Malaysia and India. So we are there to guide you and we are there to assist you as well. So with this, I thank you, all of you, for attending this webinar. And until we meet on our upcoming webinar for in next week with the same topic as what doctor said is a continuation of this week's topic. So from here, I would like to thank all of you. Happy Father's Day once again and enjoy your day and have a blessed day. Over to you, Arshita.
A very good evening to everyone. Oh wow, what a wonderful session it was. I hope you all gain more knowledge about today's topic and information. And I thank each and everyone for being here today and take a time patiently listen what our consultants said. And any doubt or any clarification, you can connect with us or any time. We had fixed same user ID and passcode for upcoming webinars, so don't miss it. We are here to assist you. Stay tuned with us for upcoming webinars. Stay happy and stay healthy. Thank you.
Thank you, Harshit.
Thank you so much. Bye-bye.
Thank you. Thank you. Thank you.